The pandemic has created a huge demand for nurses, and that is causing some headaches for hospital administrators trying to make sure that they're properly staffed as hospital beds are filling up. Our investigative reporter Brendan Kirby has been tracking this, joining us now live. And Brendan, this is just one more problem caused by COVID-19.
Yeah, that's right, Lenise. For nurses, this has been a great opportunity to make a lot of money by going out of state, but it's been a challenge for hospitals to keep pace. The coronavirus pandemic has kept Lataya McCall busy, but it's also allowed her to make extra cash. Suddenly, she's in high demand. The Providence Hospital nurse spent a month in October at a sister hospital in Wichita, Kansas that was facing a surge in COVID-19 patients. She says her employer covered her expenses, plus paid her double her rate on top of her regular salary.
I guess that must be nice.
Yeah, of course it's nice. It allowed me to put away a little bit in my savings, so it's definitely nice.
Increased patient volumes have raised the demand for nurses, and that's been exacerbated by the tendency of nurses on the front lines to themselves get sick. The Alabama Department of Public Health reports almost 14,000 healthcare workers in the state have contracted the virus. The Alabama Department of Labor last month identified nurses as the most in-demand occupation in the state. Hospitals have lost nurses to out-of-state temporary contracts. Those same hospitals have imported nurses from other areas. Alabama Hospital Association President Dr. Don Williamson calls it a two-edged sword that's driving up everyone's costs.
Where do those traveling nurses come from? I mean, there is not this universal pool of nurses out there that people pull from. You are usually pulling staff for traveling nurses from some other facility. In some cases in Alabama, we know they're being pulled from one hospital to work in another hospital in Alabama.
Providence Hospital President Todd Kennedy tells me staffing has been a challenge everywhere, but worse in some other parts of Alabama.
We haven't had as much of that, I think, in Mobile as maybe other communities. I think Birmingham and Huntsville might have seen more of that than we did here in Mobile, but I think it is an issue.
McCall says her experience in Kansas was rewarding, but stressful as well.
They definitely seemed like they were sicker. My first day there, as soon as I got onto the floor, I had to transfer a patient to ICU. So they did appear to be sicker, and unfortunately, I actually experienced my first death as a nurse.
McCall says she's weighing where to go next and may cut back her hours at Providence so she could do another one of those temporary stints out of state. Reporting live in Mobile, Brendan Kirby, Fox 10 News.